Hello, I'm Dr. Shireen, a consultant breast radiologist here in Dubai. Part 2 of my series on keeping your breasts healthy and beautiful. We'll talk about mammograms today. Mammography is the hallmark of breast screening all over the world for women over 40 years of age. People always ask me, do I have to have a mammogram? Can I not have an ultrasound instead? The problem is, ultrasound and even MRI do not pick up things that we can see on the mammogram. The important things that we can spot on the mammogram are very early signs of cancer or precancerous conditions that can be treated very easily, and we would biopsy these. Another question I'm asked is, will it hurt? It's a bit of a squeeze, but it's not painful. The machines these days are much more gentle and the radiation dose is extremely small. So I just want to show you a couple of mammograms. So here we have breasts left and right, slightly dense breast tissue. Dense just means there's not much fat, there's more glandular breast tissue, and that's the usual for younger women. Of course, you need your glandular breast tissue. As you get older, breast involution, they become more fatty. How do we image this? So with dense breasts, as you see here, there's a lot of white and very little black. So the black is the fat, and it's very helpful to interpret the mammograms. We have tomosynthesis. I'll show you the 3D. So you can see that it cuts through, slices through the mammogram, so you see very clearly if there's any underlying lesion. And here we have a small lump, and we can use our Lunit, our AI, which circles it nicely and shows us there's an abnormality there. And this was the proven cancer. When the AI detects an abnormality in the mammogram, we go ahead and do extra mammographic views and ultrasound. Just a quick word about breast implants and mammography. We do mammograms all the time for screening for ladies with breast implants. They don't rupture implants, and we do additional views to try and see the breast tissue a little better by displacing the implant behind and pulling the breast tissue a little bit forward, and so we can get a better look at the breast tissue. So here's an example. So this white here is the breast implant, and this is the breast tissue around it. And then the mammographer has nicely done an implant displaced view, and you can see here the implant isn't in view, and you can get a better look at the breast tissue. Here we saw a little bit of asymmetry, so we went ahead and did an additional paddle view, which showed this area of distortion, which we're going to biopsy. Under the mammogram guidance, I will add that this was not seen on ultrasound. So there are things that you can see on the mammogram that we can't see on ultrasound. So mammography is important. So I hope that answers some of your questions.